welcome to You Diaries. India is facing epidemic in diabetes. Today, 67 million people are diabetic and around 70 million people are in pre-diabetic stage. Today we have Dr.Johny Kannampilly, a leading diabetologist in Lakeshore Hospital with us. Welcome, Doctor. Doctor, can you explain the complications of diabetes, please?
Diabetes is affecting lots of people today. The numbers are increasing alarmingly. It is coming even to younger people. Younger people like 20, 30, 40 are getting diabetes. It's a very dangerous situation what we are facing. It is coming like a tsunami to every homes in our country and our state. We have to be very careful of this. Now the issue is not just about diabetes. The issue is mainly of the complications it creates for diabetes, by the diabetes. Now, previously, diabetes used to come at the age of 65s and 70s, and that was reasonably okay because the complications of diabetes used to take about 10 to 15 years. And if you get diabetes at the age of 60, you get complication only by the age of 70 or 75, and it didn't really matter to the patient or to the family by any way because you are already in your old age. But think about the same scenario which is happening at a younger age. People getting diabetes at 20, 30 and 40. Your complications take only 15 years and it is very, very dangerous. It is coming like an atom bomb or a tsunami to our country, to our state, to the families, and we have to all be alert of this major catastrophe which is going to happen to our country. What are the complications of diabetes? It can affect every single major organ of your body. The whole functioning of the body can get affected. It can affect it straight from the head to the toe. It can affect your eyes and suddenly you can get bleeding into the eyes and you can lose your vision. It can affect your heart, causing heart attacks. It is known diabetic patients are 3 times at a higher risk than a normal person in getting heart attacks. You can get heart failures in a diabetic patient, and it is because the pumping of the heart becomes affected and you can get breathlessness and difficulty in walking and so on and so forth. It can also affect the kidneys and cause severe problems to the kidney, finally leading to kidney failures, needing dialysis and needing kidney transplant. Now all these complications are major health burden to just the individual, not only to the individual but also to the family members. It's going to cost a huge to treat these complications. A simple dialysis costs about 30,000 rupees per month, and it's an ongoing process lifelong once you start getting this complication of diabetes. It can affect the legs by neuropathy and arterial problems of the leg, causing amputations to the leg. You can get amputation at an early age. Now even treating a diabetic foot problem can be very, very expensive. It can affect every single blood vessel of the body. It can affect all the nerves of the body and can cause problems throughout the body. Now these sort of complications were not there about 20, 30 years back. The reason is, as I stated before, diabetes used to come at an older age. But today, because of our wrong lifestyles, which the youth is now following, we are trying to follow or mimic the westernization, going by all the processed foods and packaged foods. More consumption of that with lesser and lesser activities. We are getting into the so-called metabolic syndrome. The metabolism of our body is getting affected, and slowly we get into complications. Slowly we start getting obesity, we start getting diabetes, we start getting cholesterol problems and also hypertension. Now these are all now considered one disease of the same problem, that is the metabolic problem, or otherwise called the metabolic syndrome. Now we have to tackle this. We have to concentrate on controlling all these factors to control this dreaded problem of diabetes, that is these complications. It can affect even the sexual health of a person. even it can be for the lady or for the man, it can affect the sexual health of the person. Many people are shy to even tell to the doctors. So it is an important problem which can cause in a diabetic patient.